let's imagine that you're running a scenario. You've got a 22-year-old male patient that law enforcement has called you on. They're not entirely sure what's going on. When you get there, you've identified the patient has a history of autism. Give us some ideas in your patient assessment and your interaction with this patient. How would you speak with them? How would you minimize not having multiple steps in what you're asking the patient to do or what you're telling the patient that you're going to do as part of your assessment?
I always like to say it's kind of like going in low and slow.
Okay.
Patient, you want to get down. First of all, you want to reduce all the sensory stuff, be it lights, be it people, be it, noise, everything. You want to limit that. And then
just all the things that we have on an emergency scene, huh?
Absolutely, yeah.
Okay, good.
And not to get off topic, but if you can teach the family what we need to know after your first contact, saying, look, if we knew the child was autistic, we'd learn how to adjust our response.
Okay. That's a great point, because I tell my students that families are secondary patients that can be your best friends or your worst enemies, and they're a lot easier, and you get a lot more information from them when they're your best friend. So I think what you're saying there is outstanding information.
Well, yeah, and if you think about it that way too, with an autistic person, it's that in spades. They're not going to react well to an adversarial kind of approach, or coming in guns a-blazing. We got our kits, we got our firefighters with us. We're just go from 0 to 60 in 2 seconds. It's not going to do anybody, even a neurotypical person, any good. You're going to crank them up. With an autistic person, you're really going to jack them up, and then you're working on a meltdown. You're not getting anything done. So sitting beside them, talking softly, finding out if they like touch or don't like touch, that's key. Giving them time to respond to your questions. Not, very often, especially new medics, as we're often thinking of the next question before we hear the answer to the question we just asked.
Right. Yep.
And don't do that, because then you're not going to get anywhere with any patient, but it's certainly an autistic person. You just got to ask the question, watch their reaction, give them time to respond if they can respond. And if they're nonverbal, there are other ways to do it. Do they have an iPad? Do they have, a tablet of some sort that helps them communicate? Or you're going to have to use some other things, they write and they point to things, it's how EMS is, man. You just got to adjust.
So the question has to be asked then. I mean, we beat into the student's head what I call the BSI scene safety dance. Mm-hmm. What is the likelihood of danger for someone to get hurt, either the patient or one of the responders, if you're doing everything that you're supposed to be doing? You're shutting down lights, you're clearing the room out, you have minimal numbers of people. What's the likelihood of a patient that is autistic of becoming violent?
Well, it's always there. I mean, there's a lot of aggressive autism, but I think a large majority of autistic people are more huggers. Than aggressive. But you have to use your spidey senses. You have to get that history from your family.
Good.
They mention that the child can be aggressive. Well, maybe you don't want to be in there alone. And maybe that's a good reason to have law enforcement on scene. But the last thing you want to do is restrain an autistic person.
Right.
It's go from bad to a whole lot worse really quick if you try and restrain. And obviously, sometimes we have to restrain, be it chemical restraints with Versed, or be it, physical restraints. But autistic people aren't developed the same way neurotypical people are, and they're a bit more fragile. They have less upper body strength. So, you're really opening up a can of worms by trying to restrain or being aggressive in your approach. And you can very easily, without intending to, do everything wrong.
Sure.
And make us get make that one outcome really bad, so all future outcomes for whoever responds to this person in the future are going to turn out the same bad.